Hello, I'm Dr. Nicholas Cohen and I'm here to share with you a top 10 list of tips for alcohol abuse. Tip number 1 is to understand why drinking more than you're supposed to causes health problems. 4 out of 10 traffic accidents are caused by alcohol use. 1 out of every 4 suicides is caused by drinking. And excess drinking causes liver failure or cirrhosis and cancers of the breast, stomach, mouth, and throat. So tip number 1 is understanding the health consequences of drinking. Tip number 2 is knowing when drinking has become too much. So drinking is too much if you're pregnant. Any drinking at all during pregnancy is harmful. Also, if you have a history, if you have hepatitis, which is liver disease, or ulcers, or a family or personal history of alcohol abuse. Any of those conditions, if you drink any alcohol at all, then it's excessive. If you don't have any of those conditions, then for women, drinking more than 1 drink a day can lead to health problems. If you're a man, drinking more than 2 drinks a day can lead to health problems. And a drink is more than 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof distilled spirits. If you're 65 or older, whether you're a man or a woman, then more than 1 drink a day is considered excessive. So tip number 1 was the health consequences of alcohol, excess alcohol. Tip number 2 is knowing what is considered excess alcohol. And tip number 3, to see your doctor. Seeing your doctor is an important component of identifying and treating alcohol problems. Your doctor can screen you for alcohol misuse, can determine your readiness to change, can give you motivational interviewing if you're not ready to change, can refer you and follow up with you if you are ready to change or are considering it, and can treat any problems that are associated with your drinking. Tip number 4, motivational interviewing. Motivational interviewing is an interviewing technique that's used for people who are not ready to quit drinking alcohol. It's a counseling technique where you identify your own reasons for quitting. It recognizes that change comes from within, not from without. And in MI, there's 5 principles. The first is to express empathy with the person who's drinking. So whoever you're going through motivational interviewing with will understand your reasons for drinking and your reasons for wanting to quit, and won't be judgmental, criticize, or place blame. Second principle will be to develop discrepancy. Specifically, help you find specific examples where your drinking has led to an experience that went against your own beliefs, goals, or values that are important to you. Tip number 3 is avoiding argumentation. So you won't get into arguments when you're going through motivational interviewing. Rolling with resistance, meaning that whoever you're talking to, they'll acknowledge your reluctance to change and validate your experience. And principle number 5 is to support self-efficacy. In other words, you'll get positive reinforcement that you are able to change, and it'll help you believe in your ability to make changes in your life. Tip number 5 tip number 4 was motivational interviewing, a form of counseling that will help you if you're not ready to change. Tip number 5 is treating anxiety, depression, difficulty with sleep, and tobacco use. Anxiety, depression, sleep problems, and alcohol abuse are often related to alcohol abuse. Anxiety, depression, tobacco use, and sleep problems are often related to alcohol problems. Many people will try to treat their anxiety, depression, or sleep problems with alcohol, only making these problems worse. And many people who smoke will also drink, which is another important health problem. So treating these disorders with the help of your physician will help you no longer rely on alcohol as a solution. I recommend for everybody with any sort of problem related to alcohol, daily exercise. It can improve depression, anxiety, help with quitting tobacco, and improve your ability to sleep at night. Tip number 6 is multivitamins and supplements. If you do have an alcohol problem, it can lead to difficulty absorbing nutrients. It's important for you to take a supplement, specifically thiamine, folic acid, and a multivitamin. So tip number 1 was understanding the health consequences of drinking. Tip number 2 was knowing when drinking is too much. Tip number 3 is to see your doctor. Tip number 4 is motivational interviewing. Tip number 5 is treating coexisting problems like anxiety, depression, sleep problems, and tobacco use. Tip number 6 is taking nutritional supplements. And tip number 7 is detoxification. So if you are ready to stop drinking, then your physician will assess any signs of withdrawal with a CIWA score. A CIWA is a standardized scale that helps determine the level of your withdrawal. It's spelled CIWA. And if your score is greater than 8, then you have a risk of withdrawal, especially if you haven't had a drink in the past 8 hours. Now, if you do have a CIWA score of 8 or above, it will be important for you to detox, which means that you should not just stop drinking on your own because your risk of withdrawal is too great. You will need either outpatient or inpatient detox. Detox involves taking medications to avoid the serious consequences of withdrawal. If your CIWA score is greater than 15, then you'll probably need to go through a detox program inside the hospital, because people with a CIWA score greater than 15 are experiencing severe withdrawal. Also, you'll probably need to be detoxed inpatient if you have a history of complications from prior withdrawal, like delirium tremens or seizures, or if you have a psychiatric illness or you lack social support at home. If, on the other hand, your CIWA score is less than 15 and you have good social support, have not had serious complications from withdrawal, and don't have any psychiatric illnesses existing with your alcohol abuse, then it's possible that you and your doctor can your doctor can help you detox as an outpatient in a clinic. So tip number 7 was detox, an important component of stopping alcohol use if you are at risk for severe withdrawal. Tip number 8 is prevention of relapse. So if you have detox, or if you didn't need to detox, people who with a CIWA score of less than 8 don't need to detox, they can just stop drinking. Then if you've stopped drinking, it's important to prevent relapse. And my recommendation is going to Alcoholics Anonymous. You can go to www.aa.org to find out a local chapter's meeting times. This is a very important component for staying away from alcohol once you've decided to quit. Tip number 9, prevention of relapse alternatively can be done with medication called naltrexone. Naltrexone, 50 milligrams per day, is very helpful in preventing you from going back to alcohol after you've quit. However, it is not recommended for people who are taking opioids or have acute hepatitis or liver failure. And it's important for your doctor to monitor liver enzymes while you're taking this medication. So, reviewing once more, tip number 1, understanding why alcohol in excess leads to health problems. Tip number 2 is knowing when your drinking is too much. Tip number 3 is seeing your doctor. Tip number 4 is trying motivational interviewing if you're not ready to quit. Tip number 5 is treating anxiety, depression, sleep problems, and tobacco use. Tip number 6 is taking a supplement such as thiamine plus folic acid plus a multivitamin. Tip number 7 is knowing when you'll need to detox and knowing whether or not it should be done inpatient or outpatient. Tip number 8 is preventing relapse by going to Alcoholics Anonymous. Tip number 9 is preventing relapse by a medication called naltrexone. And tip number 10 is to believe in yourself. Alcohol misuse is extremely common and can lead to serious health consequences, but it's important for you to believe in yourself and your ability to change. I hope these tips have been helpful and help you with your change. Thank you very much for listening and have a great day.